Duke University runs an amazing program called Bass Connections. Andrea, Libby, and I have served as co-instructors for one Bass Connections program called the Pocket Colposcope, analysis of bringing elements of referral services to community care. This was a course that we taught over fall and spring semesters. We've worked with amazing partners like Dr. Patricia Garcia, the former Minister of Health of Peru, and also professor at Cayetano University and the director of the HOPE program. Our project team partnered with Project HOPE to assess the barriers to acceptance and implementation of the Pocket Colposcope from both a patient and provider perspective in Ventanilla, Peru. I'd like to know which sectors of the Peruvian economy or even the US economy we believe will recover the fastest, given that there are incredible changes in the healthcare system, particularly in Peru, when Andrea mentioned that most families only have a few weeks of savings and most of those people are actually day workers. I'd love to hear your thoughts on which parts of these economies you believe will be able to recover quickly from this, and which are going to have a more difficult time in the recovery process as we move forward.
Sure. So with regards to the Peruvian economic recovery, I believe that the mining and manufacturing sectors will be the first to recover. During the economic growth period in the past 20 years, those are the two sectors that have had the largest investment. Peru is one of the leading producers of gold, silver, and copper, amongst other minerals. And there are long-term projects that are already in place that I think will facilitate the restart of those sectors. One of the sectors that I think will be slowest to recover is the tourism economy. The Peruvian tourism economy is very large. People outside of Peru know of Machu Picchu. There's also other really fabulous locations to visit that we all know. However, the tourism sector has taken an obvious hit. And from a logistics standpoint, the airport has been closed in the last couple of months, and it may continue to be closed for some time. And so that will obviously be one logistic barrier. In addition, I think that around the world, I think that there will be less travel. And I think that, just the repercussions of COVID globally will mean that there will be less tourism to the country for some time. An immediate tourism-related factor right now too is that we're entering the period of June to August, which is the typical high season in the country, and so that's going to be a season that will be missed. And when I say tourism too, this includes not just hotels or restaurants, but it also includes the artisans and local craftsmen. And so it's going to have a large impact on the economy. And I do think that it will be the slowest to recover.
Yeah, that's interesting to hear about which sectors you anticipate recovering more quickly and those that will take a little bit more time. I think something that I'd like to just discuss with you, both of you, is related to the US sectors that will recover. I've been reading a lot about top tier universities in the US, and I think people are projecting that top tier universities will actually recover the fastest and could actually benefit from this. If you think about it, many students, I think, are considering gap years for the coming fall semester, more so than usual. And I think what that means is it will open up spots at these top tier universities, and their waiting lists will be able to significantly people on the waiting list will be able to move up in those top tier universities. If you also think about the classes and moving to online classes, where classes beyond 20, 30, 50 people will need to move to online access, these institutions can increase their student bodies. And so you can see how that could trickle down to some of the lower tier universities. And so while the top tier universities could rapidly recover, those in the middle may actually suffer the most because, again, waiting lists move up. And so if people that would target a middle tier university are now able to go to the top tier universities, what happens to some of the middle tier universities and community colleges? I think it's interesting to think about that. Community colleges may actually thrive because people are staying closer to home and then could easily take classes. But I think we really do need to think about those middle tier universities. I know that's not the only sector in the United States, but I think it's certainly an interesting topic. Libby and Andrea, do you have any thoughts? And I ask this because we are all instructors on the BAS course, and we are teaching at a higher level university like Duke. How do you think COVID will affect universities like Duke and then other top tier universities and then middle and lower tier universities?
You know, it's interesting. At Duke, these top tier universities also have a lot more, a larger portion of their student body also travel to the university versus these lower tier universities or public universities. And so, whereas University of North Carolina at Chapel Hill, they let their students know several weeks ago that they would have on-campus instruction in the fall, but it would start a month earlier and it would end before Thanksgiving, and they'd have Saturday classes. Whereas we're not really sure what's happening with the Duke student fall semester. We don't know the plan yet, just because I think there's a lot more considerations. Another interesting point is a friend of mine called me last week and said she's a tennis player. Her entire scholarship to go to East Carolina University on the coast was for tennis. And because of the pandemic, they cut the tennis teams from East Carolina. So I just think it's so variable between public and private universities of how it's affecting it from what I'm seeing. It's certainly an interesting topic that I don't know much more about. But
so you're saying those related to sports are definitely effective because those programs just may not run. I think another interesting point is international students. I think those are students that are usually paying full tuition. They don't have in-state tuition, and travel is definitely precarious, and individuals may not want to travel. So I think while higher tier institutions may thrive, I think at a cost, international students will have a more difficult time, particularly with US universities, because they do pay that full tuition, and travel is not an ideal situation right now. Andrea, do you have any thoughts on that?
Top tier universities have, they might be more nimble to be able to adapt their business model. I think all sectors in the economy will have to adapt their business models. And I do think that universities will be one of them. And the open-ended question that I have too is whether moving to a virtual-based learning, whether that will still support the same tuition revenue stream that universities have, or top-tier universities especially, have become accustomed to. And so there might need to be a recalibration of whether the name brand of a top-tier university is sufficient enough to support that level of tuition. I'm not an expert on this topic, but I do believe that it represents what all sectors are going to have to do in thinking about new ways of their models and new ways of delivering the product and new ways of engaging with people.
Andrea, thank you. I think certainly higher education can definitely be a political issue. I'd like to know if you have any suggestions or thoughts on what political issues specifically should people within the US and students like those that attend Duke University be thinking about during the pandemic?
So I think that in both countries, COVID has exposed structural inequalities, including unequal distribution of resources, or access to social and health services. And in the case of Peru, I think that COVID has also really highlighted the fragility of the health system from an infrastructure perspective. So there has been chronic underfunding of the national health system. And an example of this is actually what's happening in many cities across Peru, but one in particular, Iquitos, which is the largest city in the Amazonian region of the country, where the hospitals are practically at collapse at this point, and they don't have access to essential medicines, essential equipment, and that infrastructure challenge is really, really coming through. So patients with COVID don't have access to oxygen, and so patients are dying because of lack of oxygen, amongst other issues as well. So that's one political issue I do think will be how to refocus on investing in health and in social services. And I do think that this is across countries, and we are seeing this in the US as well, with the movement towards Medicare for all and ensuring access to care. I think, as I mentioned earlier too, I do think that food security is another political issue that I think COVID has definitely highlighted. Obviously, these challenges have existed before, but I do think that the precarious nature of the pandemic has really brought to light many of these challenges. And I think the food security will have to be part of a long-term national response. And again, I think that there's often this misnomer that these challenges are only or that they only exist in developing countries, and that's not the case. And even a country like Peru, it's been a leading emerging market for decades. It's an upper middle income country, and this can happen in countries regardless of income.
Thank you for sharing that, Andrea. Libby, do you have any additional thoughts or anything to add?
So as a team, we're actually evolving the Basque Connections Pocket course that has been going on and Marlee has led for the past 4 years into a broader project that encompasses more of the different technologies within the WISH Women-Inspired Health Strategies model next year. And this project will be focused more on the intervention model as a whole, the entire screening paradigm, and how we want to shift that into a workable model in the primary care system. So there's going to be a lot of new considerations now that there's this pandemic and how we approach this project, not just in how any clinical effort will be impacted, but in the actual, I guess, healthcare delivery model that we choose to move forward on.
So I think next year's course is going to change in many ways. One of them is that, as we have seen what's happening right now with the surge demand around COVID-19 across health systems, is that essential services are being postponed and delayed. And these essential services include elective procedures, primary health care, include reproductive health. And so we've seen that, and we've seen that across countries and how that's impacting different populations. So I do think what next year's course will be focusing on is how we can continue to provide essential services under recovery efforts, and how the model has to be adapted to these different circumstances. I do think that the course and the WISH model overall is well positioned to be able to adapt. The model is based on community health principles combined with tech-enabled technology, and including self-testing technology. And I do think that this is one area that will be a wave of the future of identifying, different interventions that provide essential services either at the community level or in the home. And I think that the WISH model is one model that can do that, and that can do that well. I think that we'll have to identify what are the other barriers in order to do that. The same principles existed before of identifying what were the policy barriers, what are the cost barriers, what are the capacity barriers to do this. But I think that with COVID-19, I do think that we're going to have to just reconsider some of those barriers and adapt the model to the current situation.
Absolutely.